Well, good morning, everyone. Welcome. Our presentation comes from the Mental Health Technology Transfer Center. We are working under a cooperative agreement with the Substance Abuse and Mental Health Services Administration, or SAMHSA, and the material that's in this publication, except that taken from direct copyrighted sources, is in public domain. It may be reproduced, it may be copied without permission from SAMHSA or the authors. We'll make sure, as we said before, to make sure that we get copies of this session. That's a common question we're asked. At the end of the session, after post-production, we'll make sure that we send that out to all of the participants in this session today. We're also making sure that we're saying out loud that the views that you may hear today are expressions of opinions do not necessarily reflect the official position of the Department of Youth and Health and Human Services or SAMHSA. This is not an endorsement of any kind of DHS, SAMHSA, or any other kind of intention. In this space, everyone is welcomed. In this space, we are using normative culture for our organization, and we'd like to share that with you today. We like information, and we bring people to the learning community that are strength-based and hopeful. Our language is inclusive and accepting of diversity, of genders, of multiple perspectives and intersectionalities. We're looking at healing-centered and trauma-responsive ways of doing our work. And we want to be consistent with our policies, our actions. We want to really walk our talk in this space. We're person first, we avoid labels, we speak non-judgmentally, we avoid our assumptions, and we are clear, respectful, and understandable. In short, we want to create an environment where people are kind to one another. It is our intention, with that in mind, to make sure that we create learning products, as I said before, that are dedicated to the community at large, no matter who you are. Everyone is welcome to this space, and everything you bring to that space is important to us. No gender identity issues or sexual orientations or disabilities, your neurodiversity, your physical appearance, body size, all of our identifiers are welcomed in this space. And to that end, we want to again ask that we promote a safe and inclusive and a respectful environment this afternoon. If for some reason we have to change course and we are not able to continue this session, we will let you know that, and then we will contact you at a later point in time to explain what next steps would look like in terms of rescheduling this activity. Thank you. Some quick items again. You're all muted, so welcome to the space once more. If you have a question for our presenter, Q&A is available to you. Please use the Q&A function. If you have a comment or a link or something you'd like to share, please put that in the chat. Certificates of attendance will be mailed to you, as well as those who may have CEU requirements or specifications. They will be placed on those certificates. We will be checking for full participation before we issue CEUs, and we'll make sure that that comes to you post-production as well. At the end of this session, we'll be asking you for a brief survey, and we really ask that you take it because that helps us continue to fund these types of learning environments, bring top-notch presenters like the individuals that have been participating in this particular session and the series of cultural formulation, as well as make sure that we can do this for other types of learning environments moving forward. This is we represent Region 6, and I represent Region 6. Good morning again. My name is Mordecai Dixon. I'm a Senior Program Coordinator at the South-Southwest MHTTC. We are part of a national organization that works in implementation and dissemination of learning throughout a bunch of regions. Our regions is headquartered out of the University of Texas, and so we welcome you to this space today. It gives us great pleasure to introduce to you our third session of a series, 3 or 4. So we have had such a great time hearing from all of our presenters, and today is no exception. I want to introduce you to Dr. Martin Laroche. He has been Director of Mental Health Training at the Boston Children's Hospital at Martha Elliott, which is the oldest standing community health center in the country for the last 26 years. He's an associate professor in psychology at the Harvard Medical School, Boston Children's Hospital, and specializes in the development of culturally competent psychotherapeutic and assessment strategies. Dr. Laroche has over 100 peer-reviewed publications, presentations on culturally competent treatments with ethnic minorities, and has been principal or co-principal investigator on many research projects. Dr. Laroche is also the author of 2 books, Cultural Psychotherapy, Theory, Methods, and Practice, and Towards a Global and Cultural Psychotherapy, Theoretical Foundations and Clinical Implications. In addition, he's received many research and academic awards such as the Harvard Bridge Award, the Milton Award, and was selected Outstanding Committee Chairperson of the Year by the Massachusetts Psychological Association. And so we definitely, we've got powerful folks bringing this stuff to you today. And so we're very excited to have you, Dr. Laroche. I'm going to turn over and we can begin our presentation at this time.
Wonderful. Thank you, Mordecai, so much for that very nice and generous introduction. I'm honored to be here. I'm thankful to the Southwest Mental Health Technology Transfer Center for inviting me here. I'm honored to present with such a co-host of distinguished presenters, Dr. Luis Fernandez, Agaral, and Rousseau. It's quite an honor to be presenting with and being with all of you at this point. So thank you so much. Let's see if my slides work. Yes, they're working, but a little slight delay. All right, so what I'm gonna be doing today is talking about how to use the cultural formulation with kids. And I know that you have heard other people talk about it, but I'm gonna be mostly focused on specifically on kids. And I'll be more specific in a moment, but I need to make this disclosure. As Mordecai said, I have 2 books from which I receive royalties, and I also have a DVD from which I receive royalties. So this is what I'm hoping to be able to do today. I'm going to be talking about mental health assessments with children, particularly under 10 years of age, using the cultural formulation interview. All right, why you'll see why 10, because it's very different working with smaller children than doing the standard cultural formulation. So everything I'm going to be emphasizing and throughout this presentation is specifically more targeted to the work with kids. What am I going to do to accomplish that? The first thing, I'm going to briefly talk about assessment issues. I'll talk very briefly again with cultural issues. I'll make some developmental points. I'll give a very brief overview of the CFI. I'm going to be calling it CFI from now on, which is obviously a cultural formulation interview. And then to conclude, I'm going to provide a clinical example of how to use a CFI with this particular child. And I'm going to, in this clinical illustration, I'm going to try to integrate all these different points. So we all know what a mental health assessment is, going to the first of the 5 points that I mentioned. Don't worry, we'll get there to the clinical example. I'll go very brief about these issues. Mental health assessments are basically an attempt from clinicians to get objective clinical data of who the person is. What we really want to do when we do an assessment is get to know who the other person is, and to do so in a way that we can convey objectively to other mental health providers. For me, I think that the most important part is actually being able to find a way to see the other person, which unfortunately doesn't happen once we have all these cultural issues happening. And I'll talk about them in 1 minute. Often mental health assessments have these components: chief complaints, history of problems, mental status, diagnosis, formulation, treatment plan. You'll see why that's important if I'm able to get there. For me, assessments are influenced by 3 important sources of information. When we look at the DSM-5, it's all about getting to know the particular symptoms of a patient. We are focusing on what resides within the individual. That's kind of like the most important kind of focus when we see most assessment strategies. They're trying to get an idea who the person is, and they try to do so quite objectively by seeing their symptoms. And I think that's great. I think that it really is necessary to try to get to know people, who they are and what their individual characteristics are, what their unique experiences are, what their history is, how they're expressing their conflicts. All these issues are essential, but sometimes I have also noticed that the connection I create with them, the relationship I have with them, affects what happens in the session. My own cultural biases, my own level of clinical experience, my own mood might have an impact on the person. And I think increasingly, in my own ethnicity, my own race, being Latino may have an impact. Being male, being of a particular age, will have an impact on who they are, on what they share with me or not. And it's important to be aware of all these issues, because it has repeatedly been found that many times different evaluators may reach different conclusions about the diagnosis and symptoms because of their own assumptions. So it's important for all of us to explore these issues. So that's the second issue. The second factor that's important to kind of note. Fortunately, it has increasingly been noted. There's a growing literature that's noting how who the therapist is impacts the assessment, and they have found that's one of the most important variables that predicts therapeutic outcomes. So even more than the type of treatment, the relationship, the therapeutic alliance, the working alliance, whatever you want to call it, that you establish with the patient, is going to be the most powerful predictor of what's going to happen in therapy. There's a wonderful study by meta-analysis by Bruce Wampold, for example, who found that 35% of the therapeutic outcome variance is explained by this. So it's a significant aspect of the whole therapeutic assessment process, but it's not all of it. There's also a third factor, which is the context and the cultural meanings that we bring in to the session. It's not the same to do psychotherapy here that to do in New Delhi. And in different times, we see things very differently. For example, if I'm assessing somebody from Ukraine right now, it's going to be very different than how it would have been 6 months ago. We're all aware of what's going on, and we're all very concerned and really, really saddened by the tragedy going on. So it has an impact. that impact of what's happening in other parts of the world also affects what's happening or said in the session. So it's as well as the cultural meanings that we have in the session. So it's important to take into account these three dimensions to be able to do an accurate assessment. Unfortunately, most of the assessment tools that I know of, that I'm aware of, focus mostly in the individual aspects. Increasingly, there are some that are more relational, interpersonal, and very few and actually focus on culture. And one of my favorite tools, if not my favorite tool, is actually the cultural formulation interview, which I'll be talking about, particularly with kids in 1 minute. Nevertheless, I talked about these factors as independent, but they're highly interconnected. And you see 3 circles here. Well, some people would say the cultural factors are more important, individual factors. All right, it could be. What I want you to think about is that often what's the individual meanings are inseparable in some ways with the cultural meanings. They're all interwoven, interconnected, and it's hard to understand one without the other. So what's culture? There's a beautiful definition about what culture is in the DSM-5 that I love. Systems of knowledge, concepts, rules, and practices that are transmitted across generations. Culture includes language, religion, spirituality, family structures, life cycles, stages, ceremonial rituals, customs, as well as moral and legal systems. What I love about this definition is that it kind of mirrors culture dual nature. On the one hand, it captures a subjective meaning that people make of about themselves and others in the world. So that's on the one hand, the subjective meanings that we all create and construe of everything that surrounds us. And the second part, it's not only about these meanings, it's also about legal systems. It's also about institutions. It's also about the time and places in which things happen. Clearly, there are many ways in which diversity expresses itself, and it's important to understand that. And for me, as I was growing up, one of my favorite books actually was Don Quixote de la Mancha, which I remember reading so many times. And I think we're talking about storytelling narratives, and perhaps no book better than this one, which was the first classic novel that I know of, is how it starts. Somewhere in La Mancha, in a place whose name I do not care to remember, a gentleman lived not long ago. And it goes on kind of describing the La Mancha, where Don Quixote and Sancho Panza have all their adventures. Without understanding this context, it's really hard to understand all the adventures and all the moral dilemmas that they go through. So culture shapes everything that we know, and it influences where and how people make sense of the world. Culture becomes kind of like the category that groups everything and kind of allows people to make sense of it. But not only patients make sense of the world through their culture, mental health providers, we also make sense of the world through our own culture, the medical culture, and the institutions that taught us all these different values. Unfortunately, sometimes these cultural views don't work in sync. They can be they lead to mismatches that increase misunderstanding and problems. What happens when we don't understand people in a culturally sensitive way, if we don't see what they're going through appropriately, we may construe many of these differences as deficits. So we may end up assuming that something that's different, it's more pathology than it really is, because of not because of their their characteristics, but because of our own cultural biases. And I'm not going to go too much into this, but if people, if we can't see them appropriately, then we're not going to be able to design treatments to help them as much as we want to. And if people see that we're not helping many other people who come for services, they're not gonna trust us, and they're gonna not use us anymore, and they're not gonna access our services anymore. And then we wonder why racial ethnic minority disparities have been so prevalent and are growing. Many times we just can't see well the other person. So I'm gonna just briefly define some of the most prevalent differences. And again, I'm gonna emphasize with kids. I think one of the most important one is individualism. When we look at the literature, we are constantly seeing assumptions about what is healthy. And we see in the literature this assumption that as kids individuate and they mature, they start kind of developing more clear boundaries with others. Well, not really in many cultural groups. In many places, sometimes people actually define themselves in relationship with other people. These boundaries remain fluid, and when you ask them, who are they? They may say, I'm Martin, the son of Carmen, brother of Jose, you know? So I define myself through my relationships, not as many more individualistic people would do, as a hardworking, very disciplined person. So it's a very different kind of idea, but it's very, very prevalent, because then when we do our assessments, we are constantly assuming that what they should be doing is individuating, being more mature. And if they don't, they're enmeshed. They are really, they have poor ego strengths, they're low self-esteem, they're not self-actualizing, etc. So there's a lot of issue, and many assumptions about individualism in our literature. And it's important to be aware of them so that when we're treating them, we won't make these assumptions. And hopefully in the example that I give, I'll be talking about that. In many cultures, the essential thing is not competing, it's actually helping each other. In many other cultures, kids are kind of think that many spiritual forces may actually be having an effect in their lives. And levels of obedience. Sometimes many kids are taught not very strictly not to talk back to authorities, and not even to look into their eyes, because that's a sign of disrespect. So it happens quite a bit. And I have heard so many clinicians say to me, Martin, you saw that kid? He didn't even look at me. He really had some self-esteem issues, you know? And the reason why basically didn't look at him. Well, not really. He was just being very respectful to you as an authority figure. So it's important, and I'll talk about this a little bit more when we go to the example, but it is crucial to kind of be aware of many of these differences, and how, again, in our work with families, we actually assume these values, and then if they don't meet them, we are again psychopathologizing. A big one for me is the family structure. When we, and it's typical that we assume in the nuclear family, dad, mom, but how does this appear with kids? We only have one dollhouse. And this is going to be important when we talk about the example. What I mean to say is that kids express themselves through their play, and you need tools for them to express themselves that will show their experiences and what they are going through. Kids often don't talk directly about what they're going through, but express it through play. And many of the tools that we use, dollhouses, puppets, etc., are necessary so that they can express themselves and they can show us what they're actually going through. But if we only have one dollhouse, for example, which is what our culture many times thinks, people live only in one house, then they aren't able to reflect the richness of their whole life. So what I'm basically saying is that sometimes it is helpful to have several dollhouses so that kids can go from one place to the other, and therefore you can see how they interact not only within one part of their family, but also with other parts that are other relationships that they believe are significant for them. All right, so one of the important things in working with kids is being aware of, and there's many other cultural values but I'm not going to be able to. I'm sure that they have been discussed and will be discussed. Focusing in kids again, one of the most important things is that when we work with kids, development is crucial. Just as cultural issues are central, being aware of the kids' development, it's also absolutely essential. Yes, development, it's partly a result of our biology, our genes, but also it's affected by our context. What I'm basically trying to say to you is that when we work with kids, they are going to be in a particular developmental stage, and we need to know what the typical characteristics of that stage could be so that we won't make assumptions of what they should be doing. And 100 years ago, kids would be seen as small adults, and therefore they were judged again incorrectly and not helped sufficiently. So it's important for all of us to, if we're going to work with kids, to have a little bit of knowledge of development. It's also very interesting when you include culture and kids. Kids are very amazing, kind of expressing cultural views sometimes when you're able to connect with them, and it's also essential because many kids are highly impacted by their cultural context. So it's important to talk about them. I'm not going to explain in much detail the four stages of John Piaget, but I'm just going to go briefly so you can have an idea. You can see why this is important. There's Piaget talks about four stages. The first one is from birth to 2 years of age, the sensory motor stage, in which kids learn about the world by touching things. What you do is you touch, and then you get to know how the world works. An important kind of accomplishment during this stage is that they learn object permanence. So they know the world exists independently from what they touch or what they do. And as they are able to do that, they're able to start adhering names and labels to things, which leads to the development of language. Language becomes crucial, particularly during the next stages, because it allows kids to think more in a deeper and less concrete way, but it always remains very concrete in the first 3 stages. They do expand the vocabulary as they learn words in an amazing quick manner, but often it remains in a more concrete kind of level. And then as they develop this ability to talk, they start thinking more logically, and but their thinking continues to be quite rigid, and they continue to struggle with abstract thinking. They continue having difficulty kind of generalizing to more abstract kind of ideas. And this is central to what I want to say. If we don't have many of the questions of our assessment interviews are based on the idea that we have some abstract skills, and then our kids don't quite respond to many of our assessment questions. And that's why sometimes I find it more helpful to develop questions that are more geared towards the developmental phase, which is more concrete. So the main difference that I want to say is that on the formal operation stage, they develop metacognition, or the ability to think about their own thinking. And that many of the questions that we ask in most assessments include this kind of thinking. Consequently, they are unable to respond as thoroughly as adults usually do. So that's why it's crucial that we kind of develop tools that are more developmentally sensitive, so we can start hearing kids more appropriately. We want to hear what they have to say about culture, and not many assessment tools have been developed that are culturally sensitive. And I think the cultural formulation interview is a wonderful, absolutely great tool to use, to adapt, to use with kids. And I'll show you how to do that. The main thing is that we gotta remember that for adults, for us, we use words. Kids express themselves most of the time through play, particularly when they're in the more concrete level stages. As kids get older, they're more abstract and they can use words. And they also, one thing that happens more in the formal phase or the fourth phase is they develop more sense of autonomy, identity that keeps developing with time. So many kids are unable to do that appropriately, and they don't benefit as much from these questions. And the other important thing is that many of us believe that if we don't understand the kids' family, their context, we are not going to be able to understand them correctly. So in a way, the cultural formulation interview is a wonderful tool that can allow us to kind of get to know people, because that's the main thing that, as you all know, the cultural formulation interview does. It allows you to start exploring the cultural context in a way that's more sensitive and thorough. How to do so with kids, I'll tell you in 1 minute, but one of the first things that I wanna emphasize is that we need to find a language to connect with them. And this is perhaps one of the most difficult challenges in the beginning of the session when you meet with them. You know, if you ask them, so how are you doing? How depressed are you? You know, obviously we're not gonna go anywhere with that. So you gotta, you know, I basically am playing in the rug and kind of making silly faces and trying to have fun with them, and trying to find a way to connect with them, something that we can play together. And I was telling you about the doll houses. The problem is that many of our play therapy tools are also very culturally biased. Not much has been written about it, but they are. And you look at the puppets, mostly are white, increasingly more diversity. But we gotta try to be aware again of how through our own play, we're already constructing a setting that's gonna bias what they're gonna say or not. So that's why the first part of kind of connecting with them, I find so relevant. And it's, just, and I'll tell you more about how to do it, but some really helpful tools are, drawing with them, using Play-Doh, puppets, animal figures. I heard this, I haven't done it, creating avatars, the doll houses, etc. So if anybody of you have other ideas, suggestions, please email me. And then, yes, and please email me if you have any questions at the end. And if I haven't been able to respond to all of them, feel free. If there's something I hope you'll feel free in this presentation is that I'm here and I'm happy to connect with you now and later, and feel free to email me at any point. So this leads us to the outline of the cultural formulation, which I won't talk. Imagine but it's a wonderful tool that I hope all of you already know well. And then it leads to the cultural formulation. I've been talking about it. I'm not going to describe it in detail. I'm just going to emphasize some of the components that are extremely helpful to assess children. As you all know, the cultural formation has kind of three versions. The one is the one that's used directly with the patient. That's the one that I'm going to be talking about how to adapt and use more efficiently with children. It also has an informer version, which is basically you ask significant people of the kid what's going on with the kid, trying to get ideas of what could be happening with them. And then you got the supplementary modules. And one more thing, the informer version can be used not only with one parent, could be with two, grandparents, teachers, as many people as you are able to. And then you have all the supplementary modules. And there's a beautiful one that's extremely useful with adolescents that I hope I'll be able to talk a little bit about it and the clinical example that I'm going to be talking about. So as you all know, it explores all these 4 dimensions that have already been described. And the way I try to remember them is kind of like as a story, and we were talking about the 4 kind of areas: the definition of the problem, perception or causes of the problem, the cultural factors affecting self-coping and past helping seeking, cultural factors affecting current helping. And when I say all these different things, it's my memory doesn't remember them all. So what I have learned is kind of when I'm meeting with a kid, I try to meet with as we were creating a story, as we were, having fun, getting to know each other, and trying to see what the story they bring is. And the first thing I kind of wonder is, okay, what is the issue? Why are they coming here? So what is the theme? And then kind of, okay, what caused it? What's the past? Every story has a beginning. What is the beginning? How did it start? And if you look at the questions of the cultural formulation, you'll see how they're basically asking these issues, but in significantly more detail. And then the third kind of parts is kind of, how are you dealing with it at this point? What's happening now? And then comes the wonderful part, which is, how could it be better? What can we do to fix the problem? What is it that we're going to do in the future to help this problem be better? So it's a very simple kind of way that when I'm sitting with, when I'm on the floor with a kid, I kind of use to remind me of what's going on, because because I believe that we need to remember these questions to efficiently assess our kids well. The other thing that I love about the cultural formulation, it does allow us to go beyond the individual. Remember in the beginning how I was saying that there are 3 factors? Well, it does allow us to see the kid, but also go into their family, their context, and sometimes even to the spirit world, the ancestors, and also into the therapeutic relationship. I'll show a little bit about that. So for me, again, this kind of simple outline allows me to remember when I'm playing with a kid. So what is it that I do when before I start administering the CFI with children? Before, I need to acknowledge that these ideas are preliminary, and they're mostly the result of clinical work among some of my colleagues, my students, and are basically a clinical and developmental adaptation of the work of many wonderful researchers, from Arthur Kleiman to Dr. Luis Fernandez. And unfortunately, much work still needs to be done to test these ideas more thoroughly. But this is what we have at this point. The first thing that I've been emphasizing, we do need to know the CFI well. I don't think it's I told you my trick about how to remember it. It has a beginning, an end, middle, and I remember the questions. I think it is important that we know what the questions are, so when we are playing with a kid, we'll be able to ask him and be there. I don't believe, for me, it works to be reading a question and then the kid responding. I lose them if I do that. It's more interesting if I'm playing with them and talking with them. But the problem with that is that then I'm going to forget questions. That's why it's, again, try to remember them. As I said, the outline of cultural formulation really helps me out to make sense of things. I don't think it's a good idea for me to see a patient with understanding the culture or context. I don't feel comfortable if I'm going to meet with a patient from somewhere and I don't know somewhat about their culture. I'll try to read, understand as much as I can before a meeting with them, as well as their development. I try to know their age and have an idea what to expect from them because of development. Well, I was talking about Piaget's 4 stages. One important thing is that studies have found that in different cultures, these 4 stages may appear at different ages. Yes, they may reach a formal stage, but it may be in some countries sooner than later. It is important to be aware of these differences too. Before I start, I do talk about the structure of the setting and explain the limits of confidentiality. I think that's crucial. I do that with a parent and the child. Tell the child, whatever we say here is going to stay here unless there is any risk of danger. And yeah, if you're angry with your parent, no worries. I'm not gonna share that with them. I try to establish as much rapport as I can before asking the CFI questions. And I usually I start more general and gradually try to go more into simple and more concrete kind of questions. I haven't found it helpful to be very neutral. Okay, I have never found it to be helpful with kids being neutral. It's more, I think that when you have to connect with them, and sometimes that means to kind of feelings flow, and sometimes have if you can have fun with them, they open up even more, which is important. With younger children, I start by administering the CFI informant version with the child's guardian, 1 or more. With a child, I start asking to play with them. And again, I'm trying to figure out Am I going to be doing Play-Doh, puppets, drawings? What is it that I'm going to be, how am I going to be connecting with them? And then, you know, I try to find something, could be, sometimes I have even used my phone, I have used figures, dolls, whatever I can that they can identify with. And then I add more and more things and define the settings in which the action is happening. And then as I have the people, the setting, I kind of try to ask more specific questions. Again, you can see I'm creating, I'm not talking about people, about themselves. I'm talking, we're talking about what Mr. Telephone is doing, how Mr. Telephone is feeling, or what's going on. And I have used all types of things to connect with children, from staplers to doll houses to drawings. And it's fun because the more, you know, what sometimes just being open to experience allows you to be surprised and learn something new with them. As means to establish an effective relationship alliance, I find it more helpful to follow the flow of the child's dialogue and play. As I said, I'm not a firm believer that asking questions that I have written down is very conducive to establishing trust or openness, or I think that if I'm just playing with them, they open up more and they share significantly more. So I sometimes don't follow the questions in order. I follow, my main thing for me is to follow what the child is saying, again, as a way to keep the connection going. But I think it's crucial, again, to remember all the questions so I won't forget them. I may decide, as I will show later, that a question may not be appropriate, but I made the decision because maybe the kid already answered that question. Why am I going to repeat it? It has already been mentioned, even though I didn't ask. Sometimes I add questions, sometimes, but again, the basic idea is to remember all these questions that are crucial and to be in touch with a child so that we can actually get to know who he, she, they is. That is kind of what I would encourage all of you. And once you're able to do that, it opens many different dimensions of their experience that can really help us to see them more clearly. I sometimes allow them, I think it's helpful to know their language. Sometimes I may not know Portuguese. I say, you can say it in Portuguese if you like, and then ask him how it was to say those things in Portuguese. And then it may open up different things. It may open up different ideas of what's going on. Why? So they can translate, or I can have a translator, but it helps them to be free, because sometimes when they go from one language to the other, it opens up many different dimensions of their experience. Sometimes they talk in the third person, and I often try to follow how their language. I use the language they use as much as I can. If I'm using Zoom, I ask them to show me around. I think it's better to do it in person, and hopefully we will all be able to do it more and more in person, but at times I have used Zoom, and I try to use also these strategies. After administering the CFI to a child, I may administer to a teachers or any other important family person. One of the advantages of Zoom is that if the person is from Pakistan, you can even talk with one of the grandparents in Pakistan and get information and talk with them if the parents allow you to do so. I do encourage all of you to look at the child, the adolescent module also. So I'm going to give you an example, and this is identified and somewhat composite case of an 80-year-old boy that I'm going to call Mario. Mario lives with his father, mother, grandparents, and 3 siblings. He is the third of 4 siblings and has an 11-year-old brother, a 10-year-old, and a 5-year-old baby sister. His parents and grandparents only speak Spanish, while Mario prefers English. However, he is able to understand Spanish. His parents moved to Boston over 10 years ago from a rural Latin American country, seeking better economic opportunities. I first administered the CFI informant version to Mario's mom, who stated, "Mario is being very disrespectful. He sometimes even talks back to his grandparents. Can you believe that?" And much more, and many more things that she say about Mario's horrible behavior. So Mario entered my office reluctantly and did not look at me, nor did he seem to want to talk to me. I asked him if he would like to play with the dollhouse, and he ignored my question. When I asked him if he wanted to play with some Play-Doh, he categorically said no. He, however, did agree to draw. Remember, what he's coming for is what mom is basically saying. He doesn't listen to anyone. He's a troublemaker. He doesn't even listen to his grandparents. How disrespectful can you get? And I'm just trying to make it more interesting as I talk about it. So he said no to the Play-Doh. He, however, did agree to draw. So I let him draw whatever he wanted. And after a few minutes, I said, "Oh, wow, what a beautiful car." And he smiled. And he seemed to be pretty pleased about it. And then I asked him if he could draw people, and he nodded. And then he agreed to draw a family. I asked, so he started drawing the family. I asked who is it, slowly I asked who is in the drawing, where are they, what's going on, and what would make them visit me. Okay, so this is what you see in red is how the question of the cultural formulation interview is presented. Blue is often a way in which I use it with kids. You can see, for example, that sometimes I say it more, "How come you guys are talking to me today?" You know, it's because, again, so many times, you know, the family is coming to see me. It's not only him. So it makes it more kind of like a relational thing, and makes it seem less clinical. Sometimes it's more you. In this particular case, I said, what would make them visit me? That, again, what I try to do is I frame the questions according to what's happening in the session. It's not, again, I try to use what's going on so I can connect with them, but that means that I have to be, again, very aware of the questions. And Mario said, the family is home, and he identifies each figure. You can see me over here. He did not write that until later, and says, they're all happy, but the boy isn't. The boy isn't listening to anyone in the family, and he talks back to them. And you can see how at first I was struggling to find the right means to connect with Mario. I tried the dollhouse, Play-Doh, puppets, whatever, and as a way to communicate and play with them and try to make the setting much more concrete, so which would be more consistent with his developmental stage. And also, we were talking about him indirectly through the figures he drew, which I think was making talking somewhat less threatening. Again, following his third person language, I ask, what do his parents think about him talking back? And this is again an adaptation of the second question of the cultural formulation, and what he says, his parents think he is a bad boy. It was moving how he said that. And I say, what is the worst part about talking back following the third question? Nobody loves the boy. The baby gets all the attention, getting visibly sad as he says that. And the boy feels very alone, looking at the drawing and making him look darker. You can see that he's the darkest one there. In an effort to be empathic, I said, it must be hard for the boy to feel that nobody loves him and that the baby gets all the attention. And Mario did not say anything, but he seemed to nod. I felt it was important to acknowledge his feelings, even though this is not a question of the cultural formulation interview. After a little pause that I hope would allow him to regroup, I asked Mario, what's going on that the boy is talking back? And again, I'm as you can see in the slide, I'm trying to explore what the causes, how he perceives the causes of the problem. And Mario responds, nobody listens to him. And again, he looks down, he seems visibly sad. Moving to the fifth question, I ask, it must be so sad for the boy that nobody listens to him. So I'm trying to be empathic, and then what do his parents think is happening to the boy that he's talking back? They think he's a bad boy, bad. Why else would he talk back? And then I ask, and his teachers, that he's bad and dumb. And then kind of exploring more about this. Is there anyone in the boy's family, and you can see how I'm still talking the third person, that makes him talk back less? And Mario says, when the family listens to the boy, he's fine. But he gets angry when they don't understand what he's saying in English. My grandparents don't even know English, and it gets me mad. Clearly, I notice at this point how he's now talking about himself directly. Sometimes they make me eat Spanish food that I don't like. I love mac and cheese, French fries, and burgers, and they never make them for me. And at that point, he writes me in his drawings. He's now talking directly about himself. The seventh question is, what makes the issue worse? I did not ask it because I saw he already answered it. When they talk in English to him, when he doesn't feel heard, then he gets angrier. And he's talking about French fries and mac and cheese. So I use that. I don't want to lose the flow. So I say, other than French fries, mac and cheese, and burgers, what else is important for you? Oh, and that is when I'm when I'm exploring more about his identity. And Mario says very clearly that people talk to me. Even though I prefer English, even though I'm the darkest one in the family, I wish they would talk to me in English. It's also important that they don't make him eat food that he doesn't like. Again, changing to the third person. And he would like to spend less time with his grandparents. And I said, kind of exploring more Nine's question, they don't talk to you in English, they make you food that you don't like, and you have to spend all that time with grandparents, and they treat you as the darkest one. And I'm trying to wonder more what this means, but also suggesting something else. Yes, he exclaims, they don't get me. They don't like me. Sometimes I just want to run away or start yelling. And at this point, it would have been, now that I think of it, it would have been a nice opportunity for me to explore even more his mental, what his feelings were, and also ask about additional things, about his safety, about anger, other anger feelings, sleep, concentration. So what I'm trying to say is that cultural formulation also gives you a lot of openings to explore in more detail many of the symptoms that they might be experiencing. But I said, I hear how you're feeling, and no wonder you want to yell and you want to run away. And then you're not treated as the darkest one in the family. Yeah, he says, but remains silent, as if he didn't want to say more. And then to the 10th question, it would have been something like, is any part of yourself making you talk even more? Which I did not ask, because I think I already have an answer for it. And I didn't want to blame him more for what he was feeling. I think he was already being quite rough on himself, and I don't want to make it even worse. What have you done? So kind of talking about self-coping, like trying to explore more about how he's dealing with these things. What have you done to stop talking back? And he says to me, what do you mean? I talk back all the time, I just do. Have you found that if you do some things, then you talk back less often or less strongly? No, he says, I cannot stop it. They get me angry. And I say, going to question, have you asked for help? No, nobody can help me. Nobody can help you. And again, I'm using what he's giving me to kind of explore the next kind of the barriers that he's bringing. And then he says, my parents and Mario responds, my parents and grandparents only speak Spanish. They don't know English well. Sometimes they can even understand me. So if they can understand me, how can they help me? And then the next question would have been something like, what could help you stop talking back? I didn't ask because, again, I felt that he already answered. And I instead asked, what do you think the boy's family thinks he should do to stop talking back? And he says, they think he should pray more to be a good boy. But the boy only gets anger when he needs to repeat another Padre Nuestro. Oh, you don't like praying. I hear that. And then to the last question, it would not in red. It would be sometimes doctors and patients. You can see it there. What I basically asked Mario is, sometimes doctors don't understand kids. Has that ever happened to you? And he says, all the time. Doctors don't seem to care or even listen to me. And he seemed visibly angry. And I said to him, did it happen with me? No, he says, you listen to me. I hope so. Then I wasn't quite sure, but so I asked, maybe later you will think of something that I could have done better. And I hope if you do, you can share with me. Again, this is one of the beauties of the cultural formulation is that you can start with talking also somewhat about the relationship. And often in the beginning, they're going to be more reluctant to say how you may have not said things that were appropriate. And I go on to say, is there anything we can do together? Remember the last part is how can we make the story better? How can we fix it? So I say something like, is there anything we can do together to help the boy? And I pause. I know that he had been talking in the third person. And then I say, anything we can do to help you talk with your family? And he says, yes, you can make them listen to me. And I say, if you like, we can work on it together. Can we? Maybe we can find a way for all of us to talk about what's going on. And maybe they can find some space to hear you. And that's what we did. So the CFI was not only helpful in understanding Mario's issues in a culturally informed way, that is a more ecological and thorough manner, but also allowed me to engage him and his family, which increased treatment adherence, and finally also helped me design a treatment plan that was consistent with the family's view, which I think was therefore more effective. His family attended family treatment and was gradually able to listen to Mario's concern and find ways for him to work and complete chores. The family was always complaining that Mario was not doing much with his siblings as they talk in English. And he got to understand that he would have to spend some more time with his grandparents because his parents worked. But they also were able to talk about the meals. They were also able to talk about language and ways to kind of solve these issues. In addition, Mario talked about how he felt bad, not only being the darkest in the family, but also in school. And I'll talk about how I addressed that briefly using a supplementary module. I know I have to stop in 1 minute. The school age children and adolescent module is a great way to explore the child's issues, how it's emerging in different contexts, how these different contexts are impacting what the child is experiencing. And the one thing that if you notice, I kept asking is about also how it's pretty how his skin color was impacting him and the family. But then I asked him to, following again what happened. You notice that I asked all these questions within the drawing. I followed that, and I asked him, asked Mario to draw himself, to draw a boy in his school. And this is what he drew: the teacher, me, and the classmates. It's hard to see here, but they're all blonde and white. And he's, again, the darkest one. And he was able to talk about how in school, he feels like he is dumb because he's the darkest one. It's bad to be dark. It's not, people think poorly of him because of that. And he was able to talk about that in the family. And his family also talked about him as El Negrito, in the family. And he told him he didn't like that, even though it's an endearing term. He just didn't like it, and it made him feel bad. And he was able to share that with them, and they were able to stop that. And he was talking about these issues with his family, allowed him to have a better voice to address these issues, also in his family, in his school. So this is a little illustration of how you can use the questions of the cultural formulation interview to assess children. And I'm really happy to hear any questions. I know we only have a few minutes, but I would love to hear any questions, comments, concerns.
Thank you so much, Dr. Martin. That was incredible information. Our first question reads, how would you go about the interview without sounding judgmental or offensive?
I hope I wasn't judgmental, offensive here. I was trying to make it more interesting. I'm sorry if I did. I think as I say that, one of the things that really helps people, me, is to allow them to express their points of view. I make mistakes all the time, and I encourage them gradually. They won't say it in the first session, to tell me when I am making an assumption that's incorrect, so that they can correct me. And Mario would be very good in doing that. He was very clear about what he wanted and disliked. And I think that what usually happens is once you hear kids, you hear people, they're also more open to hear differences. And I think that's kind of what often happens when you hear people. The problem is when you're not heard, you get angry and you get more upset. I think that it helps to try as much as we can, being aware that we have our limitations, to be humble. And there's a really beautiful term, cultural humility, and that's growing importance in the cultural literature that I think we should all practice. Be humble. We may have some credentials, but we're getting to know the other person. Let's hear them as much as we can, and be open to who they are, realizing that we will make some mistakes.
Thank you for that response. And our next question actually is it's got a lot of tears. I'm going to try to do some honor to it. It reads, remember Sesame Street? Interculturality is very important. The neighborhood produces changes and adaptive abilities. What do you think about this?
I think the neighborhood clearly makes a lot of, can help significantly. I agree. And I think that what we need is actually to have more cultural dialogues. We need to be able to talk about what we like and dislike. And I think, again, that as we're able to voice our ideas and our opinions, we're more open also to hear other people. I think that's a lot of what we need, more kind of openness to each other. That's what the cultural formulation interview does. It allows us to see each other in a more complete, thorough, culturally sensitive manner. And so it allows us not to miss some parts of ourselves. We need much more of that.
Our next question reads, as a Caucasian white person, how can I work with diverse clients without them being distrustful or closed off?
That's a complex question, but the first part is what you're doing right now, to wonder about it and to realize that your ethnicity and your race will have an impact. It doesn't have necessarily to be a detrimental impact, but being aware of it and talking about it will help people to address these differences. So there's much written in the literature, and I'll be happy to give you some articles if you like, so feel free to email me, but it's a long answer. But again, it's a good start to wonder about it yourself, and then openly wonder with your patients, and then kind of find a way not to impose your own agenda. And kind of sometimes we try to be very culturally sensitive, and then we may, and in our attempt to be culturally sensitive, we might actually end up also imposing our own kind of culturally sensitive ideas to them. They might not agree with whatever we are thinking. Again, one of the wonderful things about kids is they allow us to be, they encourage us to be surprised and open. The more surprised we are, I think the more that's a great sign that actually we're beginning to see the other person more clearly.
Our next question reads, does it, I'm going to assume it is the CFI, involve all 8 dimensions of wellness?
I'm embarrassed to say I don't know the 8 dimensions of wellness.
We're going to move forward on that one, and we will read off the next question then. Can we still use the developmental theories as a reference if they didn't consider cultural language differences when created, like Piaget or Kohlberg's?
Yes, we can benefit from them, but they're not the last word. I think that I said, for example, that in many different countries, for example, in Africa, the formal stage appears at a different time than in European countries. So yes, it's a nice, helpful outline, but let's not assume that's the standard for everyone, because then we end up judging different cultures, like because they don't meet those standards. And that's what happened with Kohlberg, with women. He made a lot of assumptions that were based on his male sample, and then, many 50% of the population wasn't represented on it, and therefore it was it was not listening to them. I think that Piaget has done a wonderful work, and like all series, we can make it better. One of the wonderful things about the CFI is that it's a work in process. It's not set in stone. We're all working to make it better, and I think that Piaget talks about the same thing. We're all in process, trying to make not only ourselves better, but also our series. And that's the whole idea that Piaget brings in, that we're always trying to make things better.
Our next question, Dr. reads, is this instrument, again, the CFI, is it standardized?
That's a really good question for Dr. Luis Fernandez. And yes, as far it's very structured. And I guess my trying to understand what you mean by standardized. It's a very structured, what many people like about the CFI, it's much more structured than the outline of the cultural formulation. So it has an advantage, and it can be very useful in doing research.
Our last question in the Q&A reads, are you able to share an example of a report using the CFI you have written? I'm assuming that's maybe an offline request for a report, or maybe a discussion of what the report might look like on the back end.
Yeah, I have some I forgot to talk about this, but all right. If you look at there's an article here that I wrote with Dr. Bloom that's basically an example, somewhat thorough about that. and you can look it up, and it's de-identified also. So we can, I hope that's useful, but I think that it's very important to keep confidentiality of our work, of our patients.
Those are our Q&As for today. I don't see any others in the Q&A, but as mentioned before, we can get any questions to Dr. LaRoche or Dr. Fernandez on the back end. Wait, there's one more in there. No question. Just thanks for this astonishing presentation and conversation. Dr. Martin, I promise you, I did not prompt this, but I agree with it wholeheartedly. This was an incredible presentation today, and we look so forward to all of the work that can come from it. It's an incredible body of work, and we appreciate you being here with us today. We also appreciate all of our participants today. Join us next week as we round out this 4-part series. We're not going to talk about children specifically. Next time, we'll be talking about community and still using the CFI as a tool, as a family and community tool. And so we appreciate you so much for being here. Have a wonderful day to all. Thanks for coming.